Thank you, Jiggy. It's a very good evening to all of you. It's very difficult to run the technical session, which is the last session of the day, and when the time is running on, so I will just try to make it properly. First of all, I would like to express my thanks to Global South Coalition for Dignified Menstruation and Radha Paudel Foundation for giving me this opportunity to moderate this session. And I believe that because of the effort of Radha Paudel Foundation and especially Radhaji, the demand for dignified menstruation has become the right-based approach rather than the welfare-based approach. So this thanks to Radhaji. And we know that almost each and every menstruator faces different type of challenges, difficulties, and discrimination in the life span of menstrual cycle. We can categorize it in many phases like pre-menarche, menarche, menstruation era, pre-menopause, menopause, and post-menopause era. So the theme of this technical session is menstrual dignity across lifespan. The estimated data states that over 500 million menstruators are suffering with lack of menstrual products and related facilities. A healthy discussion is going on here that how such type of discrimination has came in our society. So in the development discourse, it also highlights that due to the scarce resources, some practices emerge and they gradually have become tradition with the rigidity. So that's why we are in this session with the main focus objective is to examine menstrual products and management practices through the lens of menstrual dignity, emphasizing accessibility, sustainability, and inclusion across all stages of life. So now I am not taking so much time, and we are starting our this session with our first presenter, Camillee Escudero. Excuse me if I am pronouncing not properly. She stands at the forefront of the menstrual health revolution, campaigning female wellness with a particular focus on professional environments. As founder of Lily of the Valley, she has transformed the landscape of women's health by supporting over 20,000 women and girls with innovative products and services while potentially diverting more than 54 million disposable periods products from landfill. She's a visionary leader at the intersection of women's health, sustainability, and economic empowerment. She pioneers inclusively in Asia and providing menstrual and intimate wear solutions to transgender men, non-binary and gender non-conforming individuals, addressing not just psychological needs but mental and emotional well-being. So Camillee, the session is over to you.
Hello.
Oh, sorry. Thank you. Sorry.
Good afternoon, everyone. It's good evening where I'm from, the Philippines. So just this one. Go back. Okay. All right. Are we still awake? So we've heard from a lot of the talks today that the global conversation around menstruation, it's historically been framed as an exclusively cisgender female experience. Now, that narrative is incomplete, and it creates real barriers for transgender, non-binary, and gender-diverse individuals. Again, I'm Camillee Escudero. I'm the founder of Lily of the Valley, and we are pioneering inclusivity in femtech in Asia. And I'm here to share about our work and how we're redefining this narrative through authentic co-creation. We've heard the words that define mainstream menstrual narratives. That's female, women, feminine, dirty, weak, private, or discreet. But when we listen to the underserved LGBTQIA+ community, they shared a vastly different reality. Many feel that innerwear remains more gendered than outerwear. The lack of affirming period care is not just an oversight, but a form of systemic exclusion. And this is the barrier that we aim to challenge. Our mission at Lily of the Valley is to redefine innerwear and wellness for women and underserved communities. We saw the harm this exclusion was causing, and we set out to be the first brand in Asia to actively co-create and co-design menstrual products with the LGBTQIA+ community. We knew from the beginning that we couldn't do this alone. We knew that the most impactful innovation comes from the community. So our methodology wasn't a one-off focus group. We started by listening to lived experiences. Then we developed prototypes and gathered incredibly detailed written and visual feedback from our trans testers. And we used that feedback to refine. They told us what worked, what didn't work, and why. We used the information to refine our prototypes over and over. It was a continuous and iterative loop of co-creation. So what did we learn from that process? We learned that while comfort or physical fit is still the top priority, comfort is deeply mental and emotional. It's about minimizing gender dysphoria. It's about feeling seen. It's about allowing for self-expression. So I want you to hear from one of the vital people from our co-creation process. This is Fire. He's a bisexual trans man. Could we play the video?
Strong sense of dysphoria. I have trouble reconciling my current body with my being a transgender person. It's really harrowing. It's hard. It was my first time to try something called period underwear. I actually wondered what that really meant because I had no idea. At first, it was a little bit difficult because I got used to using disposable items. The product was given a lot of attention, I could tell. After a while, I started to feel that it was something I could really use in the long term. It's important for us to understand that identity is a huge part of a person. And if a person identifies as trans, it's something that we should respect, understand, and accept.
As Fire's story shows, the impact is personal. But moving from creation to community poses its own challenges. Our key barrier now is awareness and education, even within the trans community. So our way forward is to partner with clinics. So we are now preparing to put up displays in a sexual health clinic. We are also in talks with transgender creators who will lead the conversation within their own channels. And we are expanding Buy One, Give One program to include LGBTQIA+ youth. So what does this mean for us as an industry of advocates? We believe that our journey offers a framework for others to adopt. First, acknowledge the binary biases within our own work. Second, center marginalized voices through co-creation, not just consultation. Third, design for the whole person, the whole being. And in this case, we design for gender dysphoria, for psychological safety, not just for flow. And fourth, normalize inclusion and incorporate in our own work. Redefining standards is a bold choice, and we invite you to choose boldly with us so that all bodies can thrive. Thank you. By the way, you should receive this card with our Menstrual Dignity Guide for Inclusive Language. Thank you.
Thank you, Camillee, for a very brief presentation and very interactive presentation and raising the challenges related to menstruation beyond binary barriers. So we are moving to our next presenter, and he is Godefroy Djomo. He is a PhD student at University of Paris Nanterre. So his work mainly focuses on women's and children's health, and with particular attention to menstrual health inequalities. So please, Godfrey.
You say my name. Hi everyone. Namaste. Yes, I'm a PhD student at Paris Nanterre. I'm trying to put some number in this topic of menstrual poverty in my study. Yes, my study is about looking beyond sanitary pads, menstrual poverty in 10 low and middle-income countries. And as we talked since this morning, menstrual poverty is a huge problem in low and middle-income countries. About 100 million of women and other menstruators as they menstruation every day, but most of them doesn't have everything they have to take to manage their menstruation, and this problem is fall in the concept of menstruation poverty, menstrual poverty or period poverty. It's like when menstruator lack resources to take care of their menstruation. And this field in scientific world is characterized by the lack of measurement. We don't know, in many years before, we didn't know who were the menstruators, where they were, and how much they were. You know, for build the policies, you should have some evidences based on the field. So, in my PhD research, I try to put some number in this concept. And the objective of my study is like to provide some quantitative evidences on menstrual poverty based on 10 low and middle income countries. And I want to also examine how individual and menstrual hygiene management factors such as material type, waste disposal, and facility access shape this experience. For respond this objective, I use some methods. I use the PMA data is a survey conducted in 10 low and middle income countries in 12 regions. I use this data for build some evidences. And period poverty was here defined as reporting at least one unmet need to manage menstruation. And I use some statistic methods for reach my findings. And I use some socio-economic variable like the age, the education, and marital status, and other. And I use also some menstrual hygiene management factor like the use of material, like privacy, access to water and soap, waste disposal, and painkiller. And like I say, menstrual poverty was here defined as the self-reported experience of one or more unmet menstrual need. In the survey, they asked menstruator the question, do you have everything that you need for manage your menstruation? If they say yes, they are put in the group of normal, in good health. If they say like, I lack material, or I lack clean water, or I lack of soap, they are put in the group of menstrual poverty. That's the methodology of this study. And the result is interesting. We have some prevalence, you know. As you can see, it is a very huge problem, menstrual poverty. In previous study, I didn't find some indicators, some number, some prevalence. So the study provides us some prevalence. I can show you it well in this figure. That's all the 12 regions that the study was conducted: Nigeria, Burkina Faso, Ethiopia, India. As you can see, in Congo Central, we have about 85% of menstruators that doesn't have everything they need to manage the menstruation. And the low prevalence was in Lagos and Indonesia. The setting of Lagos and Indonesia is urban. That's why you have this low number. And the setting of Congo Central and Burkina Faso, it's rural. That's why you have also this high prevalence. So the results show that disposable pads were most used products and were associated with lower level of period poverty. But we found some interesting result is that, however, this effect diminished on contexts with widespread unmet needs, or conversely, where most women or menstruators already had access to adequate products and facility for menstrual hygiene management. So that's where I find this result. It's technical, so I will not pass much time in this figure. And the key gaps of the study is like we have limited information on disposable materials, including the number of products used per day, because using only is not enough. We must know how much of how many material do you use per day. You know, you must have the complete information, and the detailed information on the use of reusable material also are lacking in the survey, in the national survey, all around low and middle income countries. We have also the gap in information on the actual quality of sanitation facility. We know whether they exist, but we don't know if it's clean or safe, or yeah. And the way forward of our result is about the program or projects like we saw since this morning, providing material. It's a very good way to act in this field, but the study showed that programs focusing solely on product provision are unlikely to be effective in the context of widespread period poverty, because the problem is elsewhere. The problem can be in the lack of water, in the lack of soap, but it's not only in the lack of material. That's what the study shows us. And as you know, for have the policies, you must have information, and for have information, you must have data. And the lack of data is a very huge problem in the context of low and middle income country for have more information about menstrual poverty. And thank you.
Thank you, Godfrey, to highlighting the issues related to the affordable menstruation product in low and middle income countries. So this is really a big challenge, and the facilities related to menstruation is a big issue and a concerning issue for the policymakers of Global South nations. So moving towards our third presenter. So our third presenter is Nashna Maharjan, and she is a public health professional with over 7 years of experience of maternal, newborn, and reproductive health research in Nepal. So she is currently working as a senior research and learning officer at �W𝐞𝐳 worldwide, where she has implementation the research on maternal and newborn health programs. She has authored multiple peer-reviewed publications and presented her work at national and international conferences. She is not present.
Namaste and very good afternoon, everyone. My name is Nashna Maharjan, and I'm from �W𝐞𝐳 worldwide. The topic of my presentation is absenteeism during menstruation among school-going adolescent girls in Lalitpur, Nepal. So, as we know, education is a fundamental right, and yet so many girls, especially in low and middle income countries, they face barriers, especially related to menstruation. So there has been substantial improvement in education in Nepal, yet gender gaps persist, as shown by this recent report from the Census 2021 of Nepal, showing that female literacy stands at 69%, whereas the male literacy stands at 84%. So menstruation-related absenteeism, it really undermines the dignity, equity, and right to education for school-going girls. And menstrual health-related challenges, these are really under-addressed areas, even in the urban areas, urban settings. And there have been different studies showing that so many girls miss schools during menstruation, and our study has tried to understand why they missed the schools. So we had three major objectives. One was to assess the menstrual hygiene practices and menstrual disorders experienced by the adolescent girls. Second one was to assess the prevalence of absenteeism during menstruation. And third one was to identify different factors, predisposing, enabling, and reinforcing factors that's associated with absenteeism during menstruation. This is our methodology. We used a descriptive cross-sectional design and included around 546 girls studying in grades 8 to 10 from 7 public schools of Lalitpur metropolitan city, which is a city just nearby the country's capital, Nepal's capital. And we used a two-staged cluster sampling method to recruit the participants. The questionnaire were self-administered using the Lawrence Green's PRECEDE framework, and also we had observation checklist to absorb the school environment. These are our key findings. I think it really presents a vivid picture, vivid reality, that even in the urban setting like Lalitpur, more than almost 50% of the girls, they missed schools during menstruation at least once during their period days. And the major reason for missing the school was pain. Dysmenorrhea, pain and discomfort, accounting for 88% of the absenteeism. And other reasons were fear of menstrual accidents, leakages. Similarly, there are a lot of environmental factors like lack of water supply for cleaning in school, lack of disposal system for pads, clothes, loss of confidence during menstruation, lack of privacy for cleaning or washing in school, and other factors, especially the cultural factors. We asked the girls whether they changed their menstrual products or absorbents during their school hours or not, because they go to school early in the morning and return late in the evening or during the daytime. Surprisingly, only 7% of the girls mentioned about changing their pads during the school hours. So these all factors are prevalent still in the urban setting like Lalitpur. So these are the predisposing, enabling, and reinforcing factors determining the absenteeism during menstruation among the adolescent girls. And predisposing factors are basically the beliefs, attitude, and knowledge regarding menstruation, their confidence. So 58% of the girls, they felt ashamed talking to others about menstruation. Likewise, 58%, they felt awkward buying sanitary pads. Regarding the enabling factors, which basically the supportive school environment, only 42% of the girls mentioned about getting pain-relieving medicines at school. 77% said that dustbins are available in the toilets. 78% said that they have enough water in the toilet. And only 11% of the girls received positive support from their teachers during menstruation, suggesting that teachers are maybe unintentionally reinforcing discomfort among the students. Likewise, regarding the mass media, 69% they said that they learned about menstruation from different mass media. So what next? What can we change? Since we have been hearing a lot from this morning, first of all, it's the wash improvements and improvement in the disposal systems. So these wash improvements are not just optional, it's a necessity, it's essential. Second one is free or subsidized pad distribution. So the pads are available in the school, it's readily available in the market, but it's not accessible to the girls. Third one is comprehensive menstrual education in the curriculum. It's not just the biology, but also how to practically manage their menstruation, and also different combined support and right-based messaging that should also be included in the curriculum. Likewise, maybe fostering student, teachers, and parents dialogue will help to break that silence surrounding menstruation. And educating the girls on managing the pain, telling them that menstruation pain is nothing to be ashamed of. If you are facing any pain or discomfort, you must seek for help. We must also educate the girls about the safe use of medication. And finally, we must invest more in research and monitoring to bring more evidence, to bring more activities, programs that helps to reduce the absenteeism during menstruation. Thank you so much.
Thank you, Nasma. Your presentation was very relevant with the Sustainable Development Goal 4, that is quality education. And we know that without resolving the issues related to absenteeism during menstruation, we cannot achieve the Sustainable Development Goal 4. So Now we are moving to our next presenter, so that is Prabin Vardhan. Prabin Vardhan is a dedicated social leader and health advocate, currently serving as a joint secretary of Swasthava Cancer Care, one of the India's top 10 cancer societies. And his achievements include the 𝐃𝐢𝐠𝐧𝐢𝐭𝐫𝐮𝐚𝐭 Samman 2024 from 𝐾ELO Bharat, leadership recognition from Infosys, and international acclaim for his AI-based innovation Brillevere, which won first prize at CES Vegas. So over to you.
Good evening, ladies and gentlemen. So, I being Swasthava Cancer Care's Joint Secretary, so we had the privilege to attend the session in Colombo and now privileged to be here, thanks to Radha ma'am. See, for me, I think the most important aspect to say that menstruation is dignified only if there are 5 things assured. Number 1, knowledge. Second, respect. Third, most importantly, the privacy. Fourth, comfort. And the 5th one is access. And when I say access, access to right, access to products, and many other things. So as part of Swasthava Cancer Care, we have 4 verticals. One, we do a lot of awareness sessions in rural Telangana and Karnataka of India. These are the 2 states where we are predominantly present. And when we take aware sessions, it also includes menstrual hygiene, distribution of pads, and a lot of other aspects with respect to cancer, right? We are on the preventive side of the cancer, so it is not that we only look at the cancer patient, we are onto the education of it, the causes of it, which is extremely important factor is menstrual hygiene or lack of it. The second vertical is the screening part of it. The third one is HPV vaccination, and the fourth one is the cancer actual treatment when there is a detection. The objective, as you see, predominantly to first assess, then understand the significant reason behind what they are into and where they are, and then third, promote in terms of building knowledge, promote in terms of how they should actually maintain the hygiene, what should be the preventive steps to ensure that there is no cancer related symptoms. And in India, if you look at what we have found is 70 to 80% of the cases, cancer is actually detected at a very, very later stage. It could be stage 3 or stage 4, where it becomes death-threatening. Unfortunately, that is the reality. So what we actually do is try to promote them the prevention that can probably detect at a very earlier stage and ensuring that they are not actually, it is not life-threatening, it is curable. A lot of people don't understand that cancer is curable. Unfortunately, that is the truth. So what we do is we actually give them the confidence that if you take preventive care, then it is curable. And then develop certain programs in terms of community-based. We also touch base different segment of the population. We also go to the school, villages, and then different gated communities. And surprisingly, we have find different things. In terms of methodology, we take a lot of data collection, and then data collection varies from what are the segment of population we are actually approaching to. For example, the data collection in a school will be different than data collection from a village, where mostly we screen older people, right? sometimes what we have found is older people are lesser knowledgeable than the younger population, right? Unfortunately, India being a country where the knowledge is actually flows from top to bottom, the eldest to the youngest. Your grandma might be teaching your mother teaching yourself, right? If the highest level of the family does not have enough knowledge on menstruation, hygiene becomes a real threat at that point of time. Then the clinical collaboration in terms of various, entities, clinics, hospitals. We also take a lot of gynecologists and oncologists with us to ensure that we actually get the right kind of, people to screen. We do awareness workshop. We also conduct psychological support, as it is said clinically that 50% of the disease is actually psychological. So we actually do a lot of psychological mentoring. There are a lot of knowledge that our clinical expert imparts in terms of how they should be protected from cancer. And then we also conduct outreach program. So some of the key findings, as I already said, it is surprising that sometimes you find that your kids are more knowledgeable than you. Sometimes we have found it is very surprising again. Sometimes we have found that so-called educated people are lesser aware on menstrual hygiene than the so-called lesser educated people, right? We have conducted a screening in a gated community. You know what? Not a single educated person came for the screening. All that did is they actually suggested their mates to actually come forward and do the screening. So that is the kind of reality that we encounter. 70% of the cancer survivors are seen that they actually have menstrual process within themselves, right? And they also need a lot of education, support, and they need to actually give a lot of psychological boost to ensure that they are well taken care of. Some of the key gaps that we have identified, if you look at psychological boost or engagement is not a short-term task. It needs a prolonged collaboration with the patient, with the people who are undergoing cancer, right? We make sure that our relationship with them, support system with them is much more longer than typically just identifying and giving in one session or something. If you look at one of the key aspect again is the social stigma. I think there are a lot of perceptions how the society will react in terms of menstrual hygiene or talking about menstruation. There are defined classification, whereas we all are human being and it's just a natural process. But I think menstruator and non-menstruator both are unfortunately 180-degree apart, right? I think it is very much dominated by non-menstruator, whereas menstruator are the one who are more creative and more responsible for the growth of the world. So there are a lot of support that non-menstruation need to do, and that is what we actually engage with them and give them a lot of awareness. In terms of way forward, what I think is there are a lot of things to be done. There are a lot of education. There are a lot of empathy that is required with the patient, or for that matter, with the people who are actually going through menstruation cycle. I think unless and until we educate them, we actually bring them up to the speed and understand that it is not a stigma, it is actually a natural process. And they are absolutely having the equal right to the men who are actually dominating at this point of time. It won't be eradicated. Thank you very much.
Thank you, Prabin. Targeting a specific group, cancer survival, because the cancer treatment always adversely affect the reproductive ability of women, which further create a gender-based violence and discrimination. So thank you for that. And now the floor is open for question and answer session from the audience. Any question? Please.
Thank you very much. They were all fascinating presentations. My presentation is for Godefroy. You rightly mentioned that we have had a paucity of indicators for period poverty. So your methodology, once again, looks at the MHM-related variables, right? Such as the presence of water, disposal, products, etc., etc. Is it possible to expand that definition and that framework to include the psychosocial aspects and to include dignity, a non-stigmatizing environment, to include counseling services, as well as sensitization and support services? Thank you very much.
Hello.
Hello.
Yeah, thank you for this question. I think that we can have everything we want, but we are limited by the data. You know, is a PMA survey conducted in many low and middle income countries. The main objective of this survey was not about menstrual poverty. It was about fecundity and contraception, but they have a section in the dictionary about menstrual hygiene management, where we can build an indicator to have an approximation of menstrual poverty. But that is a good point. That's why I say in the end of my slide that we have to improve data collection, because it's for provide information and build some evidence based on data, not only on slogan and other, because for build policies, you must have information. That's what my study shows. Thank you.
Okay. Thank you, Godfrey. Any other question?
Hello. Namaste, मेरा नाम जलाल है and I am from India-based organization Basic Foundation. And as you mentioned, your study was based in Lalitpur, Nepal, and your focus was on absenteeism during menstruation. So we have seen in many studies that many girls are drop out due to lack of infrastructure in schools. They can change the sanitary pads in school, and even so I just want to know, have you tried to find out any data regarding this? How much girls drop the school due to menstruation? Thank you.
Thank you for the question, sir. Yes, we did explore about the infrastructure as well. Actually, we had an observation checklist that looked at the school's infrastructure. And although we could not statistically associate infrastructure with absenteeism, the students, the girls, they mentioned about having improper infrastructure, for instance, not having locks on the toilets. Similarly, the disposal bins, they are supposed to be inside of the toilets, but they were outside. Similarly, the pads were thrown haphazardly inside the toilet. So these all were seen. However, they were not statistically significant in my study. Yeah, they were mostly concentrated around dysmenorrhea and pain. Maybe because this study was centered in Lalitpur, which is one of the urban municipalities, metropolitan city. Maybe that's why this finding could differ in other districts. Thank you.
My question is for Camillee. You, in your presentation, mentioned about designing for dysphoria. And dysphoria also, while certain experiences of dysphoria are common among trans and non-binary individuals, it is also a very diverse thing that is experienced differently by different people based on their identity, based on various other socio-cultural factors. So given that difference, how do we design for dysphoria a product that might, that might have to be mainstream or might have to be scaled?
I appreciate that question. We go back to our process of how we do the work, where we listen to these diverse experiences. From the current research that we've done, we've generated 3 designs for different experiences. One thing that I would say is that our strength is that we make the products ourselves, so we're able to make those changes, make those adjustments. And we always welcome the feedback, whether they're positive, whether they're negative, especially when they're negative, so that we can make those changes. We've created products because somebody was looking for something. For example, there was she was in college and she was bound to a wheelchair. But 3 years ago, she was a walking person. And she had come to us asking for a period product that could help her feel more independent when she were wearing this product. And so we had to design something for her to do that. So I would say that the strategy there would be to stay open and listen to the diverse experiences of how gender dysphoria is experienced by different people.
Anyone?
Thank you. Already evening. So thank you. Very excellent presentation. So I have mixed comments and question. So first one is for Godefroy. That you said that there is information get about that how many disposal pad they are using. So in fact, I did in Bangladesh, but I didn't get really the standard answer. Because of this, it depends on the blood flow, it depends on the intention, it depends on the awareness. So I don't know whether we have a standard that how can we decide that how many disposal pad a person will use in a day. So another question, should I? Okay, for Nashna, no? Sorry. So I worked for minimum 500 school in Bangladesh. Very happy that all findings is similar like you. So we did everything. We wash block, we designed, interaction we did, and then everything what you proposed, and the research also we did. But if I recall morning speech from the Radhaji, so I am seeing my program gaps that after even doing all this, then I could make dignified menstruation in school. So I am fine. I'm seeing my program gap. So we have to think differently. Another thing is that from the morning, I like everybody's definition or elements for dignified menstruation. Every person saying that this element is for the dignified. But as like a spare guideline, can we do, Radhaji, I like to get attention, Radhaji and all of us, that can you do minimum standards of dignified menstruation, what globally we have to address? So can you think for this? Last one, not at least, that we have really resource limitation, and I am from UNICEF. I know that how much struggle we are getting. So can we think for skill transfer to the community that can be minimize the resource gap? Thank you very much.
So from whom? Me? So, yeah,
Yeah,
Godfrey.
you're right in your question. It's depend on many factors. But to put some context is that we saw in previous studies that they built like an indicator of using a disposable material and non-using a disposable material. So those who were using at least one disposable material was viewed like they were in good menstrual health. And the woman or menstruator who doesn't use disposable material was put on menstrual poverty group. So this approach has been criticized. Why? Because we saw in previous study that the use of disposable material among the user of disposable material, we saw many of them declaring the lack of material. What does it mean? That using is not enough. They are using, but they want more. That means that it's not enough, because it was two separate questions in the questionnaire. Do you use disposable material, yes or no? They answer yes or no, and they have another question. What would you want for manage your your menstruation? And they could answer, I want more water, I want soap, I want pads, you see? So it's not linked. That's why the study showed that using is not enough. We must have some information about number. Maybe they use only for go to school, only for go out, only for go to see the friend, not at all, because it's very expensive in some contexts. That's why this information can build some new findings that can build some new policies as well. Thank you for your question.
Thank you, ma'am, for sharing that your work in Bangladesh also resonates with the findings that I just shared. Yes, you are correct. Those recommendations that I shared might not ensure dignified menstruation. Even I'm exploring will those interventions will ensure dignified menstruation or not. It's because my study was basically a descriptive one, just showing what is happening. So it's up to the implementers to identify the appropriate intervention that could target those adolescent girls, maybe. And my work has specifically been around maternal and newborn health, and what I have experienced is the integration within the system is something that works. And maybe collaborating with multiple sectors, not just one sector, let's say education, maybe integrating with all the sectors like WASH, education, or health, and different groups. So that could be one of the area. But like you mentioned, that does not ensure that it will satisfy our purpose. So one thing we can do is an implementation research, which I do in my institution. Implementation research is basically identifying whether our intervention works or not and how it works. And yeah, in different contexts, why it works. So it may be one of the option. Yeah, thank you.
Yeah. I just want to add on my opinion in response of your question. So, yeah.
Just 30 seconds. Global South Coalition developed the indicators for the home. How could we make the dignified, mission-friendly home? E-school, workplace, and also the indicators for making our menstrual product align with the dignified mission framework. Even the WASH infrastructure, and you can find the indicators over here. And if you like to get more details, We developed the school curriculum, and our municipality has already started to implement it. Earlier, our vice mayor shared that story, and if you like to get the English version, the book is available outside. And the songs which we prepared, this is for the kids, the rhymes for the kids. We have the rhymes in both in English, Nepali, and we are going to translate in French and Spanish. Thank you.
Okay, thank you, Radhaji. And also I am adding on one of my opinion that the eradication of all kind of discrimination based on menstruation cycle can be the global standard of dignified menstruation. And you was talking about the skill transformation. By the skill transformation, we can make the menstrual product at a local level. But being an economist, we know that when we produce a product at a very small level, then the cost would be so high. So that's why the affordability will be also a big issue regarding this. So this should be in the concern of policymakers. So make the menstrual product at a large scale and distribute it among the menstruator at a reasonable and affordable prices. So, okay, anyone else? No? So we are also, no one? So can we wrap up? Yeah. Okay, we are very thankful to our all panelists. They have presented a very good their experiences and their research here to enrich this technical session. And also we are thankful to our audience who are still awake because it's very late. So I am not taking so much time, just I am ending this technical session with again raise our voice in the favor of dignified menstruation and dignified menstruation as a human right. Okay, thank you.